You are listening to Personalization Outbreak, a podcast about the collapse of traditional corporate standards in today's more personalized world. I'm Llopis. I'm a leadership strategist, author, contributor to Forbes, and founder of the Leadership in the Age of Personalization movement. On this show, I'm interviewing executives across multiple sectors to find out how the balance between standardization and personalization can exist. Hello, everyone. Welcome back to Personalization Outbreak Podcast. You're in for a treat. You know, healthcare, once a profession rooted in purpose and trust, now faces immense challenges. I'm sure each and every one of you has, at some level, experienced something with your family or a loved one. See, professionals are stretched thin in healthcare by unrelenting stress, administrative burdens, and a creeping loss of trust between clinicians and patients. It's certainly not by intent. It's just a product of the environment that we're in. Now, add this to a system that often prioritizes profits over care, and it's clear why so many are feeling the strain. But the reality is this: change is possible. I'm hopeful. Imagine a healthcare system where clinicians are supported, resources are aligned with patient care, and trust is rebuilt through collaboration and accountability. Now, today we'll explore how personalized leadership and meaningful reform can create a system that empowers our healthcare heroes and delivers the care patients deserve. Now, our guest today, this is someone extraordinarily special. And in fact, she goes by one name in my book, Sumita. And when you experience her, you'll understand why. She's an extraordinarily dedicated healthcare executive and deeply committed to the integrity and purpose of healthcare. See, her perspectives regarding the current state of healthcare reflect passion for restoring trust and purpose and ethical practices while advocating for systemic reforms that prioritize patient care and clinician well-being. Now, look, I have a last name that most people can't pronounce, and I want to make sure you know how to pronounce it. It's Llopis, like yo peace. What's going down, yo peace? I'm going to have Sumita pronounce her name in the most culturally authentic way possible. Sumita, welcome to the show. Please share with us the phonetic or the pronunciation of your complete name for us, because it's this level of authenticity that I believe is missing in healthcare, and I'd love for you to project some on us today.
Hi, Glenn. Thank you so much for having me and for the warm welcome. So the name is Sumita Yadav. That's how it's pronounced. And thank you for giving the opportunity for me to share the exact pronunciation. I accept all forms, but Sumita Yadav is the correct pronunciation.
Now, why did I do that? It's not that I couldn't pronounce it. It's just that I think it's important for people to understand the subtle nuance of how you pronounce it. It's much like what we experience in healthcare. It's those subtle nuances that we oftentimes don't pick up that leaves the experiences that we want for our employees and caregivers and provided perhaps left shallow, while at the same time affecting the outcomes and quality care that our patients deserve. And I just wanted to make that point, is that oftentimes it's important that we ask ourselves what we're really thinking and what we're really feeling in specific moments and times, not just our patients, but the colleagues that we work with. Because it's sometimes these nuances that we don't see or that we don't know that get in the way of what we're ultimately aiming to achieve. So, Sumita, you clearly are one who views healthcare not just as a profession, but as a calling. And I've sensed this about you ever since I've met you. You're extraordinarily passionate about what you do. You're extraordinarily caring about where the industry is going. But how do you think that we begin to rebuild trust, purpose, and dignity in a system that so many people find overwhelming and misaligned?
Yeah, great question, Glenn. Um, so, Glenn, as you know, I grew up in India and I trained as a physician. So, where I grew up, being a doctor is a very respected profession. You're saving lives, so it's considered an honorable, a noble profession. And my parents took great pride in having a doctor in the family. The journey to becoming a doctor is quite challenging, as you can understand. It's extensive training and dedication that's required. As you know, only approximately 14% or so people in the United States have an advanced degree of some sorts, master's or doctorate, and physicians being one of those. So definitely extensive education. If you compare, for example, medical training to becoming a lawyer, to become a lawyer, it's approximately 7 years, including undergrad training. But to become a physician, it is anywhere from 11 to 17 or even more, depending on the fellowships, post-fellowships that you might take. So it is significant years of your life that you are giving to this profession to even begin to function as a physician. On top of that, it is a profession that requires a human being who is able to sacrifice and care for others. The whole profession is based on the notion of caring. So one could argue that healthcare professionals are some of the most educated and caring beings amongst our society, not just in the United States, in general, that could be true. So, so the way I look at it is we as society invest significant resources into building or training these human beings. And all of these human beings invest so much time and energy and dedication into coming to this point. So when you look at current environment, it is amazing to see how the breakdowns have happened, that the society has come to a point of mistrust and things that have come into the system along the way to break it down to a level that we have reached a point of distrust towards our most intellectual and most trustworthy people. So something has definitely gone wrong along the way. The way I think about it is in order to start building trust and aligning the community towards the right side of the platform, there are a couple of critical questions that we have to ask. One, probably three main questions. One, are we identifying the right people to become clinicians or the healthcare providers? The
Hmm.
second one is, if we are identifying the right people, then are we giving them the right training to do so? And if we are doing that, then the next and the final question is, are we providing the right environment, which includes the right resources, the right protocols, the right environment to excel in that platform?
Hmm.
So if we start answering those questions, I think we'll figure out where some of the challenges are and where we need to pivot to bring this to a place that we all want, because letting healthcare fail is certainly is not an option. So if we are going to have a successful healthcare system, certain things have to be changed along the way.
So let's address this for a moment, right? I know you have an opinion, and again, we can pass if you'd like, but what type of people do you think we need in this profession?
Yeah. So a couple things I already touched upon. One of the most important one is that these human beings have to be caring. There is, healthcare. There's a lot of trauma that's involved. You see people at their most vulnerable stage, and that's the baseline. If you think of all other industries, most of the times it's normal stuff that's going on, and there is a small portion of the work that requires something stressful to be addressed or some recovery that has to happen. But in contrast, if you think about healthcare, I think most of the time something wrong is going on. That's why you are seeking healthcare. Yes, there is a segment where you're just going for your annual checkups and you're,
Hmm.
just to
Hmm.
keep up. But majority of the times you end up in a clinic or a hospital, something has gone wrong, whether it's small, big, doesn't matter. So you are already in a state of emotional distress. So this is a segment of human population that focuses majority of their time. If we look at 80-20% rule, 80% of the time is on fixing something that's wrong, and only 20% is focused on just the normal piece and making sure that everything is just normal. Compared to everyone else, it's flipped. So emotions are very high. It has to be a caring community. It has to be a community that's resilient, because you cannot go through, as human beings, we cannot go through this level of trauma and not be resilient to be able to cope with it or have systems to cope with it. If that doesn't happen, it is going to show up somewhere along the way. And then certainly a lot of dedication is needed because, as I mentioned, significant amount of years of your life you're spending on just education and training. So without that discipline, without that education, dedication, it cannot happen. And then these individuals have to be intellectuals, because if you cannot do that, you do not pass the bare minimum threshold of coming into this community. um, you really have to care about the society. You have to care about the future. It is not something that you just do it and it disappears. It is something that is going to stay. This healthcare is going to stay for forever in whatever capacity with new innovations. So it has to be individuals that are willing to sacrifice, are looking at the greater good beyond themselves. There's so many professions that pay much higher compensation for much lower education or even talent compared to healthcare. So if those are the factors that you are seeking, perhaps you would not pursue this pathway. As you mentioned at the beginning of this podcast, it is a calling. So there is something inside that is bringing you to a point that you say, this is the pathway. There's certain meaning you're seeking in life. So it is a different human being that qualifies to being the right person for this field.
Okay, so let's just assume that all of those qualities or characteristics, uh, people have them going into the profession. But how do those qualities begin to coexist when you are in a working environment uh, of differences? Because there's a lot of competitive people who care, who are resilient, that want to continue their growth and evolution in a practice. So, what type of environment does the institution need to provide for these physicians or healthcare professionals to thrive? Because I think this gets us closer to the issue today.
Yeah. So the environment uh, for success has to be an environment that actually allows these clinicians, one, to actually use the skills that they spent so many years learning, and there is actual joy associated with serving the community, bringing people back to their best health, to live their best lives possible, and it's not overburdened just by administrative work or paperwork. It is an environment of continuous learning and trust. It is an environment where we learn from our mistakes and we make things even better the next time around, but it allows people to acknowledge their mistakes, because if we cannot even acknowledge, then how are we going fix it? How are we going to create pathways or protocols to make things better for future? So rather than being a punitive environment, it is an environment of learning and growth and collaboration. Again, most people are competitive who get to the levels that they do, including physicians. They are competitive, but it requires another element of collaboration. Competition cannot be the only thing. If that is your ultimate goal, then healthcare overall fails because it is healthcare responsibility is a community responsibility. We all are in it together. So it's not the success of one person somehow equates to global success. It is a success of the entire community that equates to global success. And ultimately, we have to be aware and accept that.
Very well put. And I think this is where the misalignment has started because this is an industry, a profession that is seeped in community. That's what it was. Its origin roots were to be of service to the community and its people. And I often wonder, are we still as communal as we used to be? But we don't have to address that now. And I think you're going to bring this up a little bit later in the discussion. But it begs a question. You know, medicine is often seen as a noble calling, yet many doctors and physicians are rethinking their careers today. Sumita, why do you believe um, the biggest challenges that are driving this shift, what are they on a both, are they both on a personal and systemic level?
Yeah. So, Glenn, medical profession can be really incredibly rewarding, but it can be really heartbreaking too. As I mentioned earlier, there is a lot that you see in this profession. You see people at their most vulnerable. You hold their hands. So it does take a specific human being to be able to go through that journey and to pull people out on the other side. But over years, it has become very challenging to be in the medical field and both at personal and systemic level, as you put it. For example, at a personal level, in the past, you trained so many years, you spent so much time, dedication, but at the end of it, there were financial rewards because it was considered one of the highest paying professions. However, it is no longer true in today's time. Without even a high school diploma, you are capable of having a much better financial outlook than even most of the best trained physicians can in their lifetime. So the financial element is no longer the same. Secondly, with
Hmm.
online recommendations and Google and everything and constant legal lawsuits, threats, all of that, the whole landscape has shifted. So rather than the joy of caring and curing, focus has become a lot more, can we put in more forms? Can we have more things to boxes to tick off so that we can just protect ourselves rather than what is generally the best outlook. So the burden has become so much significant, and I'm not always convinced that it is in the best interest of the patient. So many of these layers are focused around just covering rather than actually patient-focused care, which is not the reason why all these clinicians went into it. The third point I raised earlier is about all this burden of paperwork and EMR. Would you believe, Glenn, an average physician spends somewhere between 3 to 6 hours per day on electronic medical records? This is part of their work that is non-productive. It is not compensated, yet they are sitting in their offices or hospitals just completing these records. And then all of this data, there's so much data, I'm not sure about the ultimate significance, of this much of data because it's not meaningful. The way it's being captured varies from person to person, institute to institute. So if it's not uniform, it's not standard, I'm not sure the outcome of all this hard work ultimately is actually there. And I'm sure other people feel the same way. So if you look at it in summary, what we're saying is it's become much harder to practice. The joy is not always there given the tasks that are associated. And then financially, it is no longer the best alternative. And on top of that, with media, once it's sensationalized news and all the other things that happen, then suddenly if you look at it, it starts to shift, and then you wonder if this was the pathway that you should have chosen. On the other side, systemically, if you look at it, Center for Medicare Medicaid Services was established in 1965. It was a very different time. It was a very different community. And now, years later, it is not the same system. It is not the same resources. Yet, we continue to just put on additional layers, put on band-aid fixes, rather than actually thinking that maybe the systems that were established are no longer viable and something needs to be thought completely differently.
My goodness. Uh, this certainly justifies why clinicians often carry the emotional weight of their work without sufficient outlets for support. So I have to ask the question, why is this trauma frequently overlooked and what steps can be taken to help?
Yeah, again, day in, day out, physicians and other clinicians, they're going through emotional stress. And, it's not like they are given time to process it. It's not like there are any, mandatory sort of sessions that they must have if a significant trauma has happened. They just pivot from one patient to another without processing, and that's not healthy at a human level. So, from my perspective, I think like some of the, like police departments and other institutes have figured out some sort of implementing mandatory mental health days or sessions or check-ins after a significant event has happened. Perhaps we need to start incorporating those into healthcare. If we cannot take care of our own health, how are we going to take care of others? And, as I mentioned earlier, you really need to be resilient to continue this pathway. If people start to break down, then these are resources that community has invested a lot. These people have invested a lot of time and money into becoming clinicians. So if we start losing these people to other professions or other industries, then suddenly we have less healthcare workers. And then the ratio keeps on getting worse because less people are taking care of more people. And that's just not sustainable.
Much like we're seeing in nursing. So,
Exactly.
so that takes me to trust and accountability between the patient and clinicians. I mean, everything that you're saying in your story, it seems like maybe this is part of what is driving that erosion of trust. What do you believe has caused this breakdown, and how can we rebuild it?
Yeah, I think there's several reasons, Glenn. I think one of the fundamental ones is there's a lot of focus on penalties around what went wrong, more than actually sort of figuring out what went wrong and fixing it and putting resources around that new model that needs to exist. uh, we can penalize institutes or individuals for certain things, but just because they paid X amount does not automatically fix the situation.
Mhm.
So I think the way we look at these things, the perspective has to change from penalizing or sensationalizing to actually, as a community, coming up with the solutions and giving the bandwidth to implement those solutions. The second thing is the people who are um, judging the situations and the different sort of elements that come into play, I'm not sure if that's always helpful. For example, if something goes wrong, again, something from government level is involved, whether CMS, DOH, insurance companies are always involved. They're not paying, they're withholding, or even under normal circumstances, insurance companies' default setting is denials rather than, well, the clinical team made this decision, there must be something true about it, so how about we let it go and then we reconcile, later on. It's, let's just deny everything, let healthcare providers chase us, and then maybe 6 months later we'll pay if we feel like it. So that certainly is not a good model. On top of that, as I mentioned earlier, media, even people doing their own Google searches, there's nothing wrong with arming yourself with knowledge. That's always good, but the way it's used and how much it's used, and if it is used in the right context or not, we do have to ask ourselves those questions. So if we are creating models, shouldn't medical associations actually be at the top making those decisions rather than lay people coming up with conclusions, whether something was actually done right or wrong or not? And then if something is actually wrong, I'm not saying that nothing should be done. Of course, things should be done, but shouldn't they be allowed an opportunity to assess and focus and actually build it, rather than all the media takes away the focus and it becomes a distrustful situation that just continues to sort of escalate over time. So perhaps we take a step back and we put in these forums, committees, or processes in place, more than figuring out who to penalize, how much. So I think it's the focus that has to be shifted.
Was there any time in your career, and again, you could pass on this one if you'd like, but is there any time in your career that a physician shared with you how they were feeling when they were not just unknowingly, but inappropriately viewed as a victim?
Physicians were viewed as a victim.
Yeah, of delivering something that wasn't acceptable and without even by pure judgment, not knowing the facts.
Uh, yeah, not, I don't want to share other people's stories,
No, of
but
course.
what I will share is, I have seen surgeons come to my office and cry because something has gone not the way that they intended in inpatient care. The outcome was not what they were striving for. So it does take a significant toll, whether someone is judging or not. Going back to my original question, if we did identify the right people for the profession between their own traits and then what we as a society cultivated into them through their training into becoming
Mhm.
the professionals that they should be, then we have to trust that these are the right people in the right places. And if we start off with distrust, then why did we spend all this time and all these resources? What was the point of all of that if we cannot trust these people to ultimately do what is needed? And maybe there are few people that are not the right one, but then why are we basing the entire situation based on these few people? We're setting up all the protocols and we're setting up all the systems for punishment. Should the baseline not be focused around us creating the best people and then us trusting them, but having guardrails if something goes wrong, and the right way to get to the outcome, which again continues to bringing these people to being their best. I'm not going to advocate for people to leave the profession or to not be successful, because we invested so much time and energy. So our ultimate goal overall as a community should be their success, because their success ultimately means our success.
Well, as I've always said, success comes most to those who are surrounded by people who want their success to continue. And what I'm getting out of this is that the very people that we should be supporting, oftentimes we're doing the opposite. And
Yeah.
oftentimes they themselves recognize that they might be measured or judged for the wrong things that they didn't even sign up for. And then I know you shared something very sensitive, but I appreciate you sharing how that surgeon reacted and came to you because we need to know that they're human too. And not everybody's perfect, but if you're part of an environment that brings you down rather than lifts you up, then why be in the profession? And I think that that's not just about clinicians, that's any role that we're in. But I think this gets to the point. If we're building environments of mistrust, how can we collaborate? How can we unify? How can we begin to be more interconnected and interdependent upon each other when things go wrong, when the stakes are high? And I think that's where we're at now. The stakes are high, and we should have more dependency and respect and trust in each other than ever before. And it seems as if perhaps, based upon what I'm hearing from you, that we're taking two steps forward and three steps back. So, anything else that you wanted to add to that?
I think you summarized it really well, Glenn. I think we are at a point we have to reimagine healthcare. It is not the healthcare that was originally established. So many new technologies, inventions have come into play. um, Human beings are living at least 10 years longer than they were. There are so many more chronic issues that exist. So the equation is not what it was. It would be wise for us to figure out what is not working in the equation and actually change that, not just put some temporary solutions, band-aid solutions. I think we're past that point. Now the entire model looks like it's covered with band-aids. It is imploding from within because it's no longer sustainable. If you think about it, Glenn, approximately 75% or more hospitals in America have a negative operating margin. Just like take a second to think about what that means. Over 75%. If you look at some of the stats, healthcare industry is not an industry that does not have resources. There's significant resources based on 2023 data. $4.8 trillion were US healthcare expenditure. Yet 75% for hospitals nationwide are in negative operating margin. There was data
Hmm.
collected by Definitive for 4,600 hospitals, and what that reported is median operating margin for U.S. hospitals in 2022 was a loss of 3.8%. And the average operating margin was a loss of 13.5%. So if we think about it, that's the average and the median. Don't we think that now that's the normal? If the normal is a negative, something has gone drastically wrong along the way. So unless we do a complete overhaul, there are no quick fixes left anymore.
Well, I think that's why there's a need for reinvention. And I believe that because when it gets to this point, it's clear. And I know that there are regulatory constraints and we can continue to talk about all that. But a lot of this has to do with leadership, how we treat people, what things do we measure, what things can we pivot away from that just don't work anymore. Or maybe we got the wrong people in the wrong roles. Goes back to what you said at the beginning. Do we bring the right people into healthcare? Because if what's happened in the past is that we were order takers. Hate to say that. And now we have patients who have choice and options. We have employees that have choice and options. And we've gone from order taking to consumerism in the last 7 years. You're talking about a complete overhaul of a business model that wasn't designed to think of healthcare in terms of consumerism. So what have we done? Now we're bringing people in from other industries who have marketing or consumerism knowledge, and now digital transformation, bringing people from other industries. And what happens as an executive who came in from one large financial institution that we're all aware of into healthcare, they were very clear is that this is something that has so many band-aids on it. You can't bring my expertise and expect me to fix it when I'm still looking under each band-aid to see how something was uh, someone had taken a shortcut, and I'm having to understand the unraveling before I could actually use my expertise to fix all this. In other words, when you've the last 10, 15, 20 years of decisions have now reached a point to where we're at today. In other words, we don't get to situations like this overnight. They happen through an accumulation of time. And now we're expected to turn around systems with these financial struggles, and we're using outdated answers to try to fix modern day problems. And again, I'm not here to point fingers. It's just important that we realize, how did we get here? And I think you've done such a nice job, Sumita, of just helping us understand the life of a physician, a clinician, from the time they start school, or maybe from the time they had that dream of becoming a physician, through all the work they had to get in to be one. Now they're in it, and what they signed up for isn't what they're doing today. You could say that exists in education too. I mean, people who are professors or teachers, the environment has changed. You could say that for people in corporate work. But this is an industry about life and death. So when you share those data points, it's alarming. I mean, we do have the resources, but it goes back to, are we utilizing the resources the best way we possibly can, or are we trying to use them like we did in the past when times were more stable and predictable? What's your thought on that?
Yeah, I think um, I think the outdated models uh, require an overhaul. There, there are small segments that are being addressed, but not the full picture, which might solve one problem, but might create five other unintended consequences. So if we keep addressing one thing at a time, the problems that erupt are always going to be many more than the problems that we fix. And we're always going to keep looking, it's in hindsight, and at some point, we actually have to get ahead of this whole equation, or there is no way to logically fix it. I strongly agree with your thoughts around leadership. I think it does boil down to that. Um, and I'm not talking leadership in sense of who made most money or those type of things. That's not the leadership. I'm talking about leadership in true sense. People who are doing the right thing for the right reasons and actually fixing long-term things, not just in that point of time. A lot of times what happens is people are judged on what's happening in this time period so they can make it look really great. But if you look 10 years ahead, then so many things were wrong, which you will have to pay for 10 years later. Many systems did not invest in EMR timely, but then they were able to show financial sort of positive status for a limited time. And then, okay, those people retire. That's great. But 10 years later, the generations that come into that space, suddenly they have a broken system. So not only do they have to compete with current trends and technologies, they actually have to fix 10 years worth of past, which now is an exponential path to fix. And that's where all these challenges exist. So leaders that genuinely do the right thing. Secondly, you talked about expertise. Um, I feel so many leaders are either ill-suited or ill-equipped to handle the roles they're positioned in. And it might be because they have, it might be several reasons, whatever they are, personal, maybe they're good making connections. And those are great skills to have. But if you either do not possess the skills or you're not capable of getting those skills quickly, then you're doing a disservice as a leader to that institute, to the community. And I think those things have to be they have to count for more than just the instant whatever moves that happened. So that's a bigger topic, maybe for another time. But I do think that leads to some of these challenges.
Well, in what it does, it goes back to the discussion around trust. I mean, look, if I've learned something in the last 30 years of the work I do, people inside organizations know what's going on. I mean, these things are not a surprise to people. So what is this basically saying as we move on to the close to the final question here, Sumita, is that we as leaders are incumbent to be accountable to our own evolution. We can't rely anymore on institutions to prepare us for the future. And I know that that may sound a bit harsh, but with things happening and changing so fast, and individual needs and societal needs changing at such a rapid pace, we can't expect the institution to keep up with it. We must individually and therefore collectively um, find that within us to keep ourselves updated and relevant. Because if we wait for the institution to tell us, the marketplace will continue to pass us by, especially in healthcare now, where we're in an age of consumerism and personalization that it has elevated expectations from it. So, with that, you talked earlier about the importance of reimagining healthcare. What changes, again, just high level, what changes do you think are the most urgent ones to help adapt to, again, these changing needs of today's patients and clinicians and medical advancements?
Yeah, so I think, as you said earlier, healthcare is a collective responsibility for humanity. So pointing fingers, it does not offer any solution. So that cannot be it. Um, Penalties only go so far. So, okay, there could be a system. Well, I mean, it's fine, but it doesn't, again, solve anything. What we really have to start focusing on is are there deeper level things? Are the people really the right people in the positions that they are in? It could apply to the clinicians, it could apply to the healthcare leaders administratively as well. If we find the right people for the roles, again, different type of traits apply to different type of roles. For healthcare, there are specific traits, and certain traits have to weigh more than others. A little bit of selflessness, a little bit of caring, that it has to be fundamental to everyone working in healthcare space. So if we find the right people and give them the right training and the tools, then we have to come to a point where it's governed more by trust rather than mistrust. And that would happen when the system is actually working and not everyone is the judge. Everyone cannot be the judge for everything. Yes, everyone can have an opinion, but we as a society are failing if we have not implemented the right guardrails. So that's where, so the layer where I think most impact would happen is, as I mentioned earlier, there are so many associations and societies, medical societies. Perhaps it's time that they take a stronger stance, because they actually have the expertise in each of the subspecialties. So perhaps the team of experts, and there could be other stakeholders from different industries or patient communities, but it has to be the right expertise level that sort of looks upon a situation and says something worked or didn't work and what didn't work, and then has an actual action plan and change or improvement is mandatory. It cannot be a choice that there's a mistake happened, change or don't change, as long as you pay a fine. That cannot be it. The ultimate goal has to be improvement. If mistake was happened, that's okay, but you have to learn from it, improve, and not make that again. That's how, one step at a time, we continue moving towards progress and towards building this trust that yes, we are learning and improving and not hiding. Hiding does not help anyone. So we have to focus on the right metrics, the right things to look at. So just a shift in perspective and where resources are put in would go a long way.
As I listen to you, reminds me of an article I recently wrote on Forbes around the three um, different styles of leadership. And one is all around knowledge and expertise. Um, but when it's all about knowledge and expertise, and we don't know what to do with that knowledge and expertise because we may not be in the right environment in which to utilize it wisely, then it stays in isolation. And then the next is being more collaborative, right? More connected to those that you're serving. But this can also fall into the same trap. I mean, instead of feeling isolated, now you have access. But what if you don't know what to do with that access that comes from collaborating and connecting with colleagues in a different way? And then finally, the one that I believe that we're in today is one of self-reflection, well-being, what's purposeful, like what matters. And I think your message throughout this entire interview has been centered on we need to look from within. We need to ask ourselves, why are we doing what we're doing? Look at the well being or lack thereof that we've created because the environments that we are in are not about embracing different ways. They're not about being overly inclusive. They're not about um, being more empathetic and compassionate with our own wrongdoings. It's about knowledge and expertise. And I just shared this with you because you've done such a great job of taking us through these different kind of stages or different types of leadership styles. And what I'm hearing your conclusion is if we don't start looking at each other and asking ourselves, why do we have to keep competing against each other and ask each other, what is it that matters most to you? What is what fuels what you care about? And let's get everybody united to understand that in the end, our mission was driven to save lives. And now we're trying to save political agendas. That's what I'm taking away from this. And by the way, these things, I mean, one can always point fingers. I'm not here to point fingers, but I'll just share some basic wisdom. I believe that every strategy or insight or business or even industry starts with a noble cause and a noble intention. But when external factors, hidden agendas, and bureaucracies get in the way, we tend to veer away from those noble intentions. And then we get this. So I appreciate everything that you've shared today, but I'd love for you, if you wouldn't mind, Sumita, to leave us with a hopeful thought or message, because we're both doing this interview not just to create awareness of what we can improve, but also to help people realize that there is hope. You know, things when we've reached these levels of let's just say of distrust and or misunderstandings, we can only find opportunity by knowing that there's got to be a better way, and we're all going to get there eventually. But what can we do to maybe uh, accelerate this process?
Yeah. So, Glenn, I strongly believe that most people, if not all, in healthcare um, uh, do come from a place of compassion, are are extremely dedicated, hardworking people. So it is a really great group of people.
Oh yeah, no doubt.
Right. So there have been challenges, but the challenges have been process and model challenges more so. And again, it has been an escalated rate of improvements in technologies and everything. So very fast pace of learning. But this is a community that believes in continuous learning. Not just the upfront learning phase, but on an ongoing basis, the amount of learning that they're doing is significant. So I think the solutions are there. We all just have to come together. Competing in any business is okay, but healthcare is one space that applies to all. And the ultimate goal for all of us is just the well-being for all of us. So all the other things sort of take a little bit of a back seat. So if we all just sort of silence the noise around us a little bit and just focus on things that are our priority issues to focus on and just logical solutions, just working together, I do think that we can come out of it. The pathway is going to be through this dedicated team working together and not some external force coming in to fix it. So the right people are there, the resources are there. As we said, a significant portion of GDP exists in healthcare. It just is shifting our perspective on how do we utilize those resources. So we have enough pieces of the puzzle that collectively, if we come together and we focus on it, we can find it together.
And I'll put a bow on this. When you have the right people, when you have the right resources, but when you don't have the right environment, the people and resources don't work. So I think what I'm walking away with today is that healthcare leaders, I hope you're listening. You all know the environments in which you work in. I think it's time to address these issues head on. We can no longer walk away or hide beneath a veil that may not be as authentic as it once was. These environments are important, but I understand what happens when we're concerned. We become afraid. We grasp for more control, and we don't actually allow our people to contribute in the ways that they want. And as a consequence, we don't make the right decisions on how we use the resources. Just food for thought. Sumita, thank you so much for your time. Always a pleasure. I would greatly appreciate your support. And thanks again.
Pleasure has been mine. Thank you.
As we leave every show, when you lead in the age of personalization, you will see things that others don't, do what others won't, and keep pushing when prudence says quit. Have a great day. Thanks for listening to Personalization Outbreak. Make sure to subscribe so you never miss a show. If you enjoyed the content, visit ageofpersonalization.com to check out our free streaming video series and learn how to get involved in the movement. I'm Glenn Llopis. I wish you a good day, and remember, without strategy, change is merely substitution, not evolution.